Anatomy and Physiology, Visceral Circulation. In this lecture, I'm going to talk about the arterial supply of the GI tract, as well as the venous drainage of the GI tract. Now for a little overview. The aorta gives rise to three major visceral branches to the GI tract: the celiac artery, superior mesenteric artery, SMA, and inferior mesenteric artery, IMA. Venous drainage of the GI tract is ultimately through the portal vein, and I will explain that later. As I said, the three major visceral branches are the celiac artery, superior mesenteric artery, and inferior mesenteric artery. So here's your celiac artery, celiac trunk, celiac axis, whatever you want to call it, superior mesenteric artery, and your inferior mesenteric artery. Let's talk about the celiac artery. The celiac artery gives rise to three main branches. You have the left gastric artery, which is here. Got your left gastric. You got your splenic artery, because it provides blood supply to the spleen. It actually branches into the pancreatic artery, the left gastroepiploic artery, which is here, and the short gastric artery, of which there are usually multiple short gastric artery, and of course the common hepatic artery, which gives rise to the hepatic artery proper, the right gastric artery, and the gastroduodenal artery, which also gives rise to the right gastroepiploic artery, and the superior pancreaticoduodenal artery. The next major visceral arterial branch is the superior mesenteric artery, and it gives rise to the inferior pancreaticoduodenal artery, which anastomoses with the superior pancreaticoduodenal artery, which comes off the hepatic artery, which comes off the celiac axis. It gives off jejunal and ileal branches, which are these. It gives rise to the iliacolic artery, and sometimes it gives rise to the right colic artery, which sometimes comes off the iliacolic artery. And of course, the middle colic artery, which is not really well seen here. Your middle colic artery gives off blood supply to the transverse colon. Your inferior mesenteric artery gives off your left colic artery, sigmoid branches, superior rectal, so now that we've talked about the three major branches of the visceral arterial blood supply, let's focus on blood supply to the stomach. Now, as we recall, there's a lesser curvature and a greater curvature. So lesser curvature, greater curvature. Your lesser curvature is supplied by the left gastric artery and the right gastric artery. So lesser curve is supplied by a gastric artery, which can be either right or left. Your greater curvature is supplied by the gastroepiploic arteries. So you have your left gastroepiploic coming off the splenic, and your right gastroepiploic coming off the gastroduodenal. And of course, there's some short gastrics as well, which give blood supply to the stomach. Now, the distribution of arterial blood supply is based on the embryologic development of the GI tract. And the GI tract consists of the foregut, midgut, and hindgut. The celiac axis supplies blood to the foregut. So any structures that are derived from the foregut are supplied by the celiac artery. So that includes stomach and duodenum up to the ligament of Treitz, which is about the fourth portion of the duodenum. The superior mesenteric artery provides blood supply to any structures derived from the midgut. So the small intestine, distal to the ligament of Treitz, up to the proximal 2/3 of the transverse colon. The inferior mesenteric artery provides blood supply to the hindgut, which is the distal 1/3 of the transverse colon, up to the rectum. So basically, foregut is celiac axis, midgut is superior mesenteric artery, hindgut is inferior mesenteric artery. So foregut is distal esophagus to proximal half of the second part of the duodenum. Midgut is basically small bowel distal to the ligament of Treitz to the proximal 2/3 of the transverse colon. And hindgut is distal 1/3 of the transverse colon to the rectum. Now let's talk about the venous drainage of the GI tract. And we're mainly talking about the portal vein here. So it's actually pretty simple, because the splenic vein and superior mesenteric vein join to form the portal vein. The portal vein bifurcates into a right and left portal vein branch before entering the liver. The inferior mesenteric vein typically drains into the splenic vein. The gastric veins, and when I say gastric veins, they typically mean short gastric veins, drain into the portal vein. Now let's make a special note of blood supply to the liver. Let's talk about the arterial blood supply. So the arterial blood supply, the hepatic artery supplies about 25% of the blood flow to the liver, but carries 50% of the oxygen supply. The portal vein supplies about 75% of the blood flow to the liver, which makes sense because it drains the nutrients from the GI tract into the liver, but it carries 50% of the oxygen supply. The venous drainage, your left, middle, and right hepatic veins drain directly into the vena cava. So let's look at this picture here. You got your hepatic artery supplying 25% of blood flow to the liver, your portal vein supplying 75% of blood flow to the liver, but each of these vessels is responsible for 50% of the oxygen supply. All right, we are done. Like this video, subscribe. Thank you.